You wake up. Your mouth feels like you slept with a handful of sawdust in it. Thick, sticky, uncomfortable. You reach for water on the nightstand, rinse, and think nothing of it. Just another morning. Getting older, right? Well, I need you to stop right there, because that thought, that dismissal, that 5-second decision to move on and ignore it, that might be one of the most consequential mistakes you make this year. My name is Dr. Adrian Volker, and I've spent decades in clinical practice watching people explain away symptoms that their body was absolutely screaming at them. Dry mouth in the morning is one of those symptoms. And I know that sounds almost laughable. Dry mouth. Not a heart attack, not chest pain, not a lump somewhere alarming. Dry mouth. But stay with me, because by the time we finish today, you are going to look at that morning dryness completely differently. There is a chain reaction happening inside your body when this occurs, and it starts long before you open your eyes. Understanding it won't just make your mornings more comfortable. It could protect you from pneumonia, from infections that spread into your bloodstream, from losing teeth you've kept for 70 years, from a decline that nobody saw coming because everyone was looking somewhere else while the real problem was hiding in plain sight. This isn't a minor inconvenience. It's your body waving a red flag. And today I'm going to show you exactly what to do about it. Before we go any further, and if you're new here, welcome. I'm Dr. Adrian Volker, and this channel is dedicated to the health information that most doctors simply don't have time to explain during a 15-minute appointment. Hit subscribe and turn on the bell notification so you never miss a video. Now, let's get into this, because what I'm about to share genuinely matters. So let's start at the beginning. Let's talk about something most people have completely taken for granted their entire lives. Saliva. I know. Nobody wakes up thinking about saliva. Nobody goes to their annual physical and asks their doctor how their saliva is doing. It's just there. It's always been there. And like most things that are always just there, people don't notice it until it's not. But bear with me here. And because once you understand what saliva actually does, what it is made of, and what it is actively accomplishing inside your mouth every hour of every day, you will never think about it the same way again. Most people assume saliva is basically just watered down spit, something your mouth makes so food doesn't stick to your teeth, something that shows up when you smell something good. That assumption is wrong in about 15 different ways. Saliva is one of the most biologically sophisticated fluids your body produces. It is not water with a little something added. It is a highly engineered biological solution that your body manufactures continuously around the clock in dedicated glands, specifically designed for this one purpose. And what it does with that fluid is remarkable. Think about what it's actually doing every single hour of every single day. It is fighting. Your saliva is packed with antimicrobial compounds, proteins called immunoglobulins, enzymes like lysozyme and lactoferrin, peptides with names most people have never heard of, all of them working in concert to identify and neutralize bacteria, viruses, and fungi before they get a foothold anywhere. This isn't passive. This is active biological defense happening continuously in your mouth without you giving it a single thought. Every time you swallow, and you do it hundreds of times a day without thinking about it, you're sweeping a wave of biological security through your mouth and sending those pathogens straight down into the acid environment of your stomach where they get destroyed. Without enough saliva, that sweep doesn't happen. The bacteria don't get moved along, they stay, they multiply, they establish colonies, and your mouth becomes the kind of environment that doctors have very unpleasant technical terms for. And it doesn't stop there. Saliva is the very beginning of digestion. There are enzymes in it, amylase being the most significant, that start breaking down carbohydrates the moment food enters your mouth. Before it even reaches your stomach, the process has already begun. When you chew and your saliva mixes with your food, you are not just softening things mechanically. You are beginning a chemical transformation. When saliva is low, that process is disrupted from the very first bite. The food arrives in your stomach less prepared than it should be. And for older adults in particular, where nutrient absorption is already something we watch closely, where stomach acid production has often naturally decreased, where the whole digestive process is less efficient than it was at 30. That disruption at the very beginning matters more than most people realize. Saliva also maintains the pH balance inside your mouth. After you eat, acid levels rise. Bacteria produce acid as a byproduct of consuming food particles. Your enamel, the hard outer coating of your teeth, is vulnerable to that acid. Saliva buffers it. It neutralizes the acidity, brings the environment back to a safe range, and gives your teeth a fighting chance. Without adequate saliva flow, that acid lingers. It sits against your enamel for longer. And that sustained acid contact is what begins a process of decay. People with dry mouth don't just get slightly more cavities, they can experience a rate of tooth destruction that is shocking compared to what they were used to. But here's the thing I really need you to understand. The reason dry mouth in the morning is so dangerous specifically. Saliva is what allows you to swallow safely. Think about that. Try it right now. Just swallow. Notice how smooth that is. Notice how your saliva coats everything and allows it to move in a coordinated, controlled way. That is not accidental. That is engineering. The food you eat needs to be formed into a cohesive, lubricated package that your throat muscles can move in one clean, directed motion. Saliva is what makes that package. It binds food particles together, it coats the surface, it allows the whole thing to slide through your throat and down your esophagus without incident. Now imagine trying to swallow a piece of dry bread, a bite of chicken, or a handful of granola in a mouth that has been dry for 8 straight hours. The food doesn't form that cohesive, lubricated bundle. It breaks apart. It becomes loose. It becomes unpredictable. Bits of it separate from the main mass. And that unpredictability, as I'll explain in a moment, is where the real danger lives. The medical term for chronic dry mouth is xerostomia. And it's not just a description of how you feel. It is a measurable reduction in salivary output that leaves your mouth without its primary defense system. Doctors can measure it. Salivary gland function can be tested, and when those numbers fall below a certain threshold, the consequences we're going to talk about today become significantly more likely. Every night that you sleep with your mouth drying out, you are sleeping without your guard. Your oral environment shifts from a carefully balanced ecosystem where different organisms exist in a managed equilibrium to something closer to an uncontrolled biological experiment, where the most aggressive, damaging species take over because the thing that was keeping them in check has disappeared. That sticky morning feeling isn't just unpleasant. It is the evidence. It is the physical proof left on your tongue and the roof of your mouth that your defenses were down all night and things were happening in there that you would not want to see under a microscope. I want to pause here for a second. If what I've shared so far has already changed the way you're thinking about this, hit the like button right now. It genuinely helps this video reach more people who need to hear it. People who are waking up every morning dismissing a symptom that deserves their full attention. Now, let's talk about what's actually causing this. So who's responsible for this? What's actually causing it? And here is something I want you to pay attention to, because it is almost never just one thing. It's almost always a combination, a kind of perfect storm of factors that stack on top of each other and amplify each other's effects. And when you hear them, I think you're going to recognize yourself in at least one or two of them, maybe more. The biggest culprit for most adults over 60 is medication. Not one medication specifically, but the accumulation of medications. There are over 500 commonly prescribed drugs that list dry mouth as a known side effect. 500. Blood pressure medications, antihistamines, antidepressants, anti-anxiety medications, muscle relaxants, medications for bladder control and overactive bladder, medications for Parkinson's disease, certain pain medications, some diabetes drugs, diuretics of multiple varieties. The list goes on far longer than most people expect. And here's what makes it genuinely complicated. Each of those medications on its own might produce only mild dryness, a slight reduction in output that you might not even notice consciously. But when you're taking 3, 4, 5, sometimes 10 or more of them together, and that is not unusual for adults in their 60s, 70s, and 80s, those effects don't just add up. They compound, they layer, they interact in ways that your prescribing doctors, who often see you for different specialties in different offices on different days, may not be tracking as a unified picture. They interfere with the nerve signals that tell your salivary glands to produce. They alter the composition of whatever saliva is being made. They affect blood flow to the gland tissue itself. Think of it like a factory where the order forms keep getting lost, the supply deliveries keep getting delayed, and half the workers have been sent to other departments. The machinery is there, the capacity is there, but the instructions aren't arriving consistently. The raw materials are reduced, and so production slows to a fraction of what it should be. Maybe you've noticed something like this yourself without connecting the dots. You've been on a medication for years and your mouth felt fine. Then a new prescription got added for something unrelated, and gradually, not overnight, mornings started feeling different, drier, stickier. That gradual onset is one of the reasons it goes unnoticed. People don't connect the new medication to the new symptom because the connection develops slowly. And because dry mouth sounds so minor, nobody puts it at the top of their list of things to report. But it belongs there. It absolutely belongs there. The second major cause is how you're breathing at night. During sleep, you should be breathing through your nose. Your nose is specifically designed for this job in ways that your mouth is not. The nasal passages filter incoming air, removing particles and pathogens. They warm the air to body temperature before it reaches your airways. They humidify it. By the time air that enters through your nose reaches your throat and lungs, it has been processed and conditioned. Your mouth bypasses all of that. If you're breathing through your mouth during sleep, whether that's because of seasonal or chronic nasal congestion, structural issues like a deviated septum, enlarged adenoids, severe allergies that swell the nasal passages, or something more significant like obstructive sleep apnea, then for 7 or 8 hours every night, dry, unfiltered, unconditioned air is moving continuously across every wet surface in your mouth. Imagine leaving a shallow dish of water out on a breezy windowsill on a dry day and coming back 8 hours later to find it nearly evaporated. That is essentially what is happening inside your mouth. The moisture is being drawn out by continuous airflow. The saliva that would normally coat and protect your oral tissues cannot keep pace with that evaporation. It dries up, and what's left behind is a warm, dark, increasingly desiccated space that anaerobic bacteria, the kind that thrive without moisture and produce the most toxic compounds, find absolutely ideal. Sleep apnea deserves specific mention here because it connects dry mouth to a much larger conversation about overnight health. People with untreated obstructive sleep apnea mouth breathe not just because they prefer it, but because their airway is periodically collapsing during sleep. The body compensates by opening the mouth and working harder to breathe. If you snore heavily, if you wake up frequently at night, if you feel unrefreshed in the morning regardless of how long you slept, if someone has observed you stopping breathing during sleep, the dry mouth you're experiencing may be one signal among several that something significant is happening while you sleep that deserves evaluation. The third cause is something that can't be fixed with a better bedtime routine or a glass of water. Sometimes, dry mouth isn't a side effect of something else. It is a primary symptom, a direct result of a condition that is actively affecting your body and that needs its own attention. Diabetes is probably the most common and most important example. When blood sugar is not well controlled, the effect reaches every system in the body and the salivary glands are not exempt. High glucose levels affect the microvascular blood supply to gland tissue, reducing the resources available for saliva production. The saliva that is produced may itself have elevated glucose levels, which is essentially like serving bacteria a ready meal right inside your mouth. They thrive on it. So you have reduced saliva quantity, potentially altered saliva quality, and a food source for pathogenic bacteria, all happening simultaneously. If you have diabetes and you're waking up with a dry mouth, those two facts are connected, and both of them deserve closer attention from your care team. Sjogren's syndrome is another condition that gets missed far more often than it should, and I want to spend a moment on it because the gap between when people develop symptoms and when they receive a correct diagnosis can be years, sometimes a decade or more. It is an autoimmune condition where the body's own immune system begins attacking its moisture-producing glands. The salivary glands and the lacrimal glands, which produce tears, are the primary targets. The result is persistent dry mouth and dry eyes that don't respond to the usual fixes. Because the problem isn't hydration or environment, it is the glands themselves being damaged. Sjogren's is more common in women, particularly in the years around and after menopause, though it affects men as well. Many people carry this condition for years, believing they simply have chronic dry eyes and a dry mouth. They manage symptoms without ever identifying the underlying cause. If your dryness is persistent, if it doesn't meaningfully respond to hydration or humidity changes, if you also have consistently dry eyes, if you have joint pain or fatigue alongside these symptoms, a conversation with your doctor about autoimmune evaluation is worth having. Other conditions that directly impair salivary function include Parkinson's disease, where neurological changes affect the autonomic signals that control gland activity, rheumatoid arthritis and other systemic inflammatory conditions, nerve damage resulting from surgery or radiation treatment to the head and neck area, and HIV and other conditions that affect immune regulation. Each of these represents a situation where the dry mouth is not the real problem. It is the messenger, and the message is that something deeper needs to be addressed. And then there are the habits, the daily choices that quietly accelerate everything else and that people often underestimate because each one individually seems minor. Dehydration is more prevalent in older adults than almost any other population. And the reason is not willful neglect. It is physiological. The thirst mechanism, the signal that tells your brain you need water, becomes genuinely less reliable as you age. The sensitivity of the osmoreceptors that monitor your blood concentration decreases. You can be meaningfully, measurably dehydrated and feel no strong urge to drink. Your body is running low and simply not sounding the alarm the way it once did. If you are not drinking water consistently throughout the day, not waiting for thirst to tell you to, your body is making prioritization decisions with the fluid it has. It is keeping your blood pressure stable. It is supporting kidney function. It is maintaining cellular hydration in critical tissues. Saliva production is not high on that list when the system is running a deficit. Alcohol deserves a direct mention here because its effect is twofold. It is a diuretic, meaning it causes your kidneys to excrete more fluid than you are consuming. You drink a glass of wine with dinner and you lose more water than that wine contained. That systemic dehydration directly reduces salivary output, but alcohol also has a local drying effect on oral tissues. And if you have a drink most evenings and then sleep for 8 hours, you are going into that night already somewhat dehydrated, already with somewhat reduced salivary function, and then adding 8 hours of sleep to the equation. The cumulative effect on what you wake up feeling in your mouth is significant. Tobacco use, whether smoking or other forms, damages salivary gland tissue directly over time and changes the microbial environment of the mouth in ways that compound everything we've already discussed. Caffeine is a mild diuretic. Coffee in the morning is not likely a major contributor on its own, but 3 or 4 cups spread through the day combined with inadequate water intake and an evening drink can absolutely tip the balance. Highly salted foods draw fluid from tissues. Acidic foods create an oral environment that saliva normally works to correct, but when saliva is already reduced, cannot correct fast enough. Right here, I want to pause and ask you something. How many of these causes did you recognize in your own life? Medications, mouth breathing, certain habits. Drop your answer in the comments below. I read every single one, and honestly, hearing from you helps me understand what to cover next. Now, let's get to the part that most people never expect. What this actually leads to if it goes uncorrected. And now I have to tell you what happens when this goes uncorrected. Because this is the part that changes everything. This is where that inconvenient morning symptom reveals what it's actually connected to. The most immediately dangerous consequence of persistent dry mouth is something called aspiration pneumonia. I want to explain this clearly and thoroughly because it is not theoretical, it is not rare, and the connection to dry mouth is real, documented, and consistently underappreciated even within medicine. Aspiration pneumonia is a pulmonary infection that occurs when material from the mouth, food particles, liquid, or even saliva itself is inhaled into the lungs rather than swallowed into the esophagus. The two passages, your airway and your esophagus, begin very close together at the back of your throat. Every time you swallow, a coordinated sequence of muscular events has to occur in a precise order and timing to direct material down the right path. Your epiglottis closes over your airway. Your throat muscles contract in the right sequence. Your vocal cords adduct. All of this happens in less than a second, hundreds of times a day, automatically. When saliva is insufficient, the material being swallowed is less cohesive, less predictable, and more prone to going the wrong direction during that split-second transition. In a young person with fast reflexes and a powerful cough, material that starts going the wrong way usually triggers an immediate and effective cough response that clears it before it reaches the lungs. As we age, that cough reflex slows. Cough strength decreases because the respiratory muscles weaken. Swallowing coordination becomes slightly less precise. The safety margins get smaller. And when a food particle or droplet of contaminated saliva does make it into the lungs, the infection that results can be severe. The bacteria responsible, the organisms that have been multiplying in that dry oral environment, are not harmless commensals. They are pathogens, organisms that the healthy mouth keeps suppressed through the constant action of saliva, but that explode in population when that suppression is removed. When those bacteria reach the warm, moist, oxygen-rich environment of the lungs, they can cause a rapidly progressing pneumonia. This is one of the leading causes of hospitalization and death in adults over 65. Not a remote possibility. a leading cause. And chronic dry mouth is a direct, modifiable risk factor sitting at the beginning of that chain. The second consequence is what happens inside the mouth itself over months and years of inadequate salivary protection. And this consequence, because it develops gradually, is the one people are most likely to dismiss until it becomes a crisis. Dental decay in the setting of dry mouth is not the same as ordinary cavities. The rate is faster, the location is different, often at the gum line and on root surfaces rather than the chewing surfaces most people associate with cavities. And the extent can be shocking. People who have had perfectly healthy teeth for decades can experience severe decay within 1 to 2 years of developing significant xerostomia. The enamel that saliva was continuously remineralizing stops being repaired. The acid that saliva was buffering sits on tooth surfaces for extended periods. The bacteria producing that acid are no longer being swept away or suppressed. The conditions for rapid, aggressive decay are perfect. From there, the consequences move beyond the mouth. Gum disease thrives in a dry oral environment because the bacteria that live between your teeth and gums are normally kept in check by saliva. Remove that protection and those bacteria multiply. They trigger inflammation in the gums. That inflammation breaks down tissue and eventually the bone underneath. Teeth that have been stable for a lifetime can begin to loosen. Even more critically, inflamed gum tissue is not a sealed barrier. A bleeding gum margin is a doorway. Bacteria from your mouth enter the bloodstream, and once they're in circulation, they travel. Research has linked oral bacteria to cardiovascular disease for decades. Specific pathogens have been found in arterial plaque. Chronic inflammation from untreated gum disease affects markers throughout the body. Markers associated with heart attack and stroke risk. Oral bacteria have also been linked to cognitive decline. This isn't fringe science. These are serious, ongoing investigations. In the most severe cases, a dental or gum infection can spread deeper into the head and neck or even trigger sepsis, the body's catastrophic response to infection. A medical emergency with high mortality even with treatment. I don't say this to frighten you, I say it to show the full picture, because what starts as a minor morning symptom can set off a chain of consequences that are anything but minor. How far it goes depends on choices you make today. Dry mouth also changes everyday life. Chewing becomes uncomfortable. Swallowing requires focus. Meals become a source of anxiety. People stop eating foods that require chewing. Steak, raw vegetables, apples, dense bread. They shift to softer processed foods. Over time, this leads to nutrient deficiencies, protein drops, fiber drops, vitamins and minerals become inadequate. Muscle mass declines, which in older adults increases fall risk. Immune function weakens. Energy levels fall. Every one of these changes makes a person more vulnerable to serious illness. And then there's the social impact. Persistent bad breath can make people withdraw. They avoid close conversation, eat alone, decline invitations. Social isolation quietly develops, and it is entirely preventable. I want to stop here and ask you to do something. Think of one person in your life over 60 who wakes up every morning reaching for water without knowing why. A parent, a sibling, a close friend. Share this video with them right now before you forget. What you've just learned could genuinely protect someone you love. The share button is right there. Use it. Now let's finish with what you can actually do about this. So what can you do? Hydration is fundamental, but not in large gulps. Salivary glands respond to steady hydration. Small sips throughout the day keep them working. Keep water by your bedside. Sip before sleeping. Sip on waking. Carry a bottle during the day. If you're over 65, don't rely on thirst. Use reminders. Your thirst signal is no longer reliable, and your body won't always tell you what it needs. Oral hygiene must compensate for reduced saliva. Use a soft toothbrush and fluoride toothpaste. Brush gently for at least 2 minutes twice a day. Use a tongue scraper every morning. Floss nightly. Avoid alcohol-based mouthwashes. They dry your mouth further. Instead, rinse with half a teaspoon of salt in warm water for 45 seconds. Stimulate what you have. Chewing sugar-free gum or xylitol mint stimulates saliva and reduces harmful bacteria. Crunchy, fibrous foods like apples, celery, or carrots provide similar benefits. Your sleeping environment matters. A cool mist humidifier reduces overnight dryness significantly. If you mouth breathe or have sleep apnea, speak with your doctor. Treating it improves oral health in ways most people don't anticipate. Gentle gland massage of your parotid and submandibular glands in the morning and before meals also encourages flow. It takes less than a minute and makes a real difference for many people. Daily habits affect saliva. Alcohol, smoking, caffeine, processed or salty foods, acidic drinks all contribute to dryness. Consistently moderating these makes a real difference over time, not perfection, consistency. Finally, professional guidance is essential. Speak with your dentist about salivary assessment, gum health, early decay detection, and prescription options. Speak with your physician about medications that may be reducing saliva and whether alternatives or timing adjustments exist. If dry mouth persists after consistent effort, prescription interventions are available, including medications to stimulate saliva, prescription strength fluoride, and advanced artificial saliva formulations. Your saliva is one of your body's most capable defenders. It protects your teeth, your gums, and your overall health. What starts in your mouth affects your lungs, your heart, your blood, your brain, and your quality of life. Listen to your body each morning when you reach for that glass of water. It is telling you something real. Today, you listen. If this video gave you something valuable, here's what I need you to do right now. Hit the like button. It genuinely helps this channel reach more people who need this information. Subscribe if you haven't already and turn on the bell so you never miss a new video. I release new content every week covering the kind of evidence-based health topics that your doctor may not have time to explain during a 15-minute appointment. And in my next video, I'll be covering another commonly overlooked morning symptom that most people over 60 are dismissing right now, and what it could mean. You won't want to miss it. I'm Dr. Adrian Volker. Take care of yourself. Your body is worth listening to, and I'll see you in the next video.